Come on in.
Good morning, Luann. My name is Lori.
Oh, hi.
Can you state your full name and birth date for me?
Luann Lonergan, 4561.
Good. I understand, Luann, that you fell this morning.
Yeah, I did.
I just wash my hands here. What happened?
You know, I was in the bathroom, there's a little water there, and I just slipped and clonked and fell.
Okay. Do you remember everything that happened? You weren't unconscious or anything like that?
No.
Good. So we have to do neurological checks on you because you fell.
Oh, okay.
So we're going to go through just a couple of questions, and I know you might know the answer, but we have to make sure that everything's okay.
Okay.
So can you tell me what day it is today?
Today is Monday, April 8th.
Good. And I'm noting that Luann isn't lethargic. She's alert. She's answering my questions. She knows who she is because she told me her name and birth date. She told me what day it is. And also, Luann, do you know where you are today?
Yes, I'm at Lakeshore Technical College.
Good. So part of the neurological assessment is we want to finish PERLA.
Oh,
and
okay.
PERLA stands for pupils are equal, round, reactive to light and accommodation.
Oh.
So that means I need to shine a light in your eyes. So if I can have you take off your glasses for me, Luann?
Sure.
So I'm going to just take a look at your eyes here, and I'm looking at your pupils just to make sure that they're both the same.
Mm-hmm.
Okay, and they look the same. And what I'm going to do now is I'm going to make sure that when I shine a light in, your pupils should constrict.
Oh, okay.
If it constricts in the one eye that I'm shining the light in, that's the direct response to light.
Mm-hmm.
And if it constricts in the other eye, that's called the consensual response.
Okay.
And I'm looking at both while I'm doing this, okay?
Okay.
So I'm going to just shine a light in here. Good. And I noticed that your left eye constricted as well as your right. So I checked your consensual response, and I'm going to come to this side and do the same thing. Good. Your direct and consensual response. Good. The next thing I'm going to test is accommodation. What I'm going to do is I'm going to hold my pen right here, Luann, and I want you to look at the pen, and then I want you to look to the far wall, and then I want you to look back at the pen. Good. And what should happen is your eyes should dilate when you're looking far and constrict when you're looking near.
Mm-hmm.
Now I'm going to move it towards your nose, and I just want you to follow the pen, and that's called convergence, and that means that your eyes are kind of working together to follow the pen light, and all of that was normal.
Oh,
that was
good.
Very good.
Good.
Okay. Luann, you told me that you hit your head.
Yeah, I just clonked it a bit.
So I'm going to just palpate here. In report, I had heard that you have a little lump on the back of your head, so I'm going to just put on gloves.
Oh,
Was
okay.
it open or bleeding at all that you can remember?
No.
Okay. Well, I'm going to just put the gloves on just in case. And I want you just to, let me feel back here. Oh, yeah, I can see you definitely have a half of a size of an egg back there. Does that hurt when I touch it?
It kind of does.
It does.
Yeah.
Okay.
Yeah.
All right. So we'll note that. The other thing we're going to do is just go through what we call, it's an acronym called OLD cards.
Oh, okay.
And it deals with pain. So I'm just going to ask you a series of questions.
Oh, okay.
And if you can just answer them to the best of your ability.
Okay.
So when did this pain start in the back of your head?
When I clonked it on the
When
sink.
you fell this
Yeah.
morning. Okay, good. And you already told me it was your head, so that's the location. And the duration, do you think is it just a how long, like just the back of your head you hit? You didn't hit anything else?
No.
And it's just been since this morning?
Yeah, and it's kind of there. It's constantly there, you know.
Okay, and the characteristic then is it sharp, dull, aching, stabbing? What kind of a pain is that?
I'd say it's kind of sharp.
Okay, so we have the onset, location, duration, characteristics, alleviating and aggravating factors. So I understand that the nurse actually gave you some Tylenol this morning. Did that help?
It did a
while
lot.
ago?
Yep.
And
Mhm.
anything else that aggravates it?
You know, when I bend it, when I hit it on something again, then I remember that it's there again.
Okay. All right, so that's the A of cards. The R is, does it radiate anywhere? Just stays the same.
Mhm.
Treatment we've already talked about. She gave you Tylenol. So again, you can have Tylenol in about an hour, so you can let
Oh,
me know
okay,
if you
good.
need the Tylenol. And the last is severity. And if you could rate your pain on a scale of 0 being no pain to 10 being the most excruciating pain you've ever had, where would you rate your pain?
It's just a 2.
It's just a 2.
Mhm,
Okay, good.
mhm.
So that's the OLCARTS acronym that we use for pain and getting all the different characteristics of the pain. That's something that we'll do.
Oh, okay.
With neurological checks, because you fell,
Mm-hmm.
we'll be coming in about every hour to do those checks. So just note that we're doing what we need to do to make sure that you didn't sustain a head injury.
Okay.
Do you have any other questions at all, Luann?
Yeah. Checking my movement.
Oh, yeah, that's right. So what we need to do, Luann, is just make sure that you can move all your extremities because,
Oh,
again,
okay.
even though you hit your head, we want to make sure that nothing else is injured.
Okay.
So what I'm going to have you do is I'm going to have you go ahead and squeeze my fingers, squeeze them real hard, and I'm checking your muscle strength.
Mm-hmm.
Very good. And then the last thing I'm going to do is I'm going to check the strength in your lower extremities, and what I want you to do is actually push down. And again, if I were at clinical, I would move you up in the bed so that you can go ahead and push down on my hands. Good, just checking the strength. So that all looks good. So just because you hit your head, I still want to make sure that your strength is good, and so your strength seems equal in all of your extremities.
Okay.
Okay, any other questions you have?
No, thank you.
Very good, thank you, and we'll see you later.
Bye.